What might happen if you don't fix knee pain from Chondromalacia Patella? Well, I strongly believe that Chondromalacia Patella is a 100% fixable condition as long as you go through the right treatment approach. But sadly, treatment for Chondromalacia Patella often involves medications, injections, and even surgery in some situations. And if it doesn't improve, people end up with worse knee conditions like a meniscus tear or knee arthritis, and later in life, they may even need to get a knee replacement surgery, and oftentimes they still have problems even after the knee replacement surgery. Some people have a parent or a grandparent that also has knee trouble, and so there may be a genetic link to this, and it's usually related to the shape of your body that's predisposing you to getting knee problems like Chondromalacia Patella. But the root cause of Chondromalacia Patella is a muscle imbalance. Let me explain that to you right here. Here you have a knee, here's the kneecap, this is the thigh bone and the shin bone down here. The muscles that are on the top of the kneecap on the front of the thigh are called the quadricep muscles, and those muscles all attach to the kneecap. If those muscles are too strong or too dominant because they're usually compensating for other muscles that aren't doing their job, other muscles that are weak and not being used appropriately, then it causes those quad muscles to get too strong, too dominant, and then it pulls that kneecap up against the thigh bone with excessive pressure. And over a long period of time, it begins to damage the cartilage behind the kneecap and on the end of the thigh bone. This can lead to pain when you're just sitting around, pain at night that wakes you up, swelling in the area, and definitely changes on the x-ray where a doctor might diagnose you with Chondromalacia Patella. It also causes other problems like tendinitis and bursitis, and usually before Chondromalacia Patella, people are told that they have patellofemoral pain syndrome. And in youngsters, when this happens for people that are in their teenage years and they're still growing, they can get something called Osgood-Schlatter's disease, where this same tendon that runs over the kneecap attaches down into the shin bone, and it can create a painful, swollen bump down here that hardens as you age, as you get out of puberty and get out of your teenage years, and might always be there the rest of your life. If you have that and have Chondromalacia Patella, you've probably been dealing with this muscle imbalance for years. Now, you may have taken medications or had an injection, and these treatments can temporarily reduce the pain, reduce the inflammation, but they don't fix the root cause, that muscle imbalance. For some people, if the medications or injections aren't working, a doctor might even recommend a surgery. They'll do surgeries like a lateral tendon release or a lateral patellar tracking release, and the idea is they're thinking that the kneecap isn't tracking right, and that's why it's rubbing back there. And so by doing a surgery to reposition the kneecap, potentially you'll get some relief. But if you're looking at this as a muscle imbalance like I am, even if you realign the patella and those quads are still overactive, you're still going to overcompress it, just in a different angle, a different position, a different patellar alignment. So it doesn't solve the root problem. Another surgery that people get is a debridement surgery, or where they clean it up. They'll go in and smooth out the surface of the cartilage on the back of the kneecap or on the end of the thigh bone, and that could help the smoothness of the tracking here, but it still allows for the muscle imbalance to be present, and eventually you'll injure it again because there's too much compression of the kneecap against the thigh bone. An extreme surgery that is sometimes done, rarely, is a patella replacement, where they'll shave off the end of the bone here and put a plastic piece on the back of the kneecap so that you no longer have the cartilage there, and now you have the beginnings of a replaced knee, but you still can have the muscle imbalance, and people often still have problems after a surgery like this. Now let's take it to the extreme. If you get past your 30s, which is when usually this peaks at its worst, if you still have that imbalance, the muscles that are in the thigh that go down past the knee joint and attach to the shin bone, they can pull up if you're using those thigh muscles too much and begin to compress the meniscus. That's what this bluish light structure is right here. That meniscus is a chunk of cartilage as well that helps to cushion the thigh bone on the shin bone, and that can only take so much before it starts to also tear and become painful and a source for other problems. And if you don't get that, you can develop arthritis when people get into their late 50s, usually 60s, definitely into their 70s and beyond. People can begin to get changes on the ends of the bones right here in the thigh, definitely on the end of the thigh bone of the kneecap here. And the bony changes no longer allow the ends of the bone here to be smooth. They're bumpy, lumpy, and rough. And that causes a lot of stiffness, pain, noises in the knee joint. And eventually, if that worsens, the very extreme is you end up getting a knee replacement surgery where they shave off the end of the thigh bone, the top of the shin bone, and they put artificial parts, and definitely on the kneecap as well. And then with that, you're not gonna ever have the same knee again afterwards. You might be able to walk, you might have less pain, but I still see patients here in my office. In fact, we've got a bunch of YouTube videos for this condition. We have something called a failed knee replacement, where people go through a knee replacement and they still have knee pain afterwards. And that's because of the muscle imbalance. It was never addressed. The root problem was not ever fixed by any of these surgeries. The patellar debridement surgery, the lateral release surgery, the knee replacement surgery, none of that fixes the root problem. You have to go through the right exercises in order to put the muscles in the right balance to avoid over compressing the kneecap, but also the rest of the knee joint. You can avoid a lifetime full of misery because you suffer with knee problems if you can fix your Chondromalacia Patella problem right now in the younger years of your life, because this is going to eventually haunt you and be a meniscus problem or an arthritis problem or a failed knee replacement problem in your very late years of life, because of the same root problem that isn't addressed by the healthcare system. And you gotta realize that most healthcare professionals out there, pretty much all of them, are out there to help you. They're trying to do the best they can with what they know. But what's taught in school is treatment using medications, injections, and surgery. And so that's what they're going to throw at you if you go to them with a Chondromalacia Patella problem. So don't expect to get anything different. Healing a Chondromalacia Patella problem naturally, like I talk about here on our YouTube channel, is not normal, and it's not something that's taught in school. You have to go through advanced extra training and work with gurus in order to learn this process. And even exercise professionals out there, like physical therapists, they're excellent at helping people recover from surgeries. But if you go to them in hopes of avoiding a surgery, in hopes of curing the Chondromalacia Patella problem, you're likely going to get them to give you exercises that are extremely similar to what they gave the person who had the ACL reconstruction surgery next to you, or the person that had the knee replacement surgery on the other side of you. Their exercises just don't change a whole lot because they don't have the knowledge, the insight, the experience of working with somebody to help them avoid surgery. So please treat the problem now, fix the root problem. If you need help with fixing that problem, check out our YouTube channel. Go down to the description of this video and you'll find a link to a playlist for all of our Chondromalacia Patella videos. You can watch that right now on YouTube so you can learn tips, advice, exercises, all the right ideas on how to solve this issue before it becomes something worse. Or you can also sign up for a patella pain recovery program, which is my comprehensive treatment approach. It's got over 30 videos that walk you step by step through how to solve a Chondromalacia problem at the root so that you're not dealing with a lifetime of knee problems in your later years. I want you to enjoy life the very last day that you have here on earth. You'll find a link to that program also down in the description next to our playlist for Chondromalacia Patella videos. Hey, if this video was helpful for you, please give us a thumbs up. Please share this with somebody you think needs to see this. If you have questions, ask. Just drop a comment on here. We love to get to our questions. I have a team of people that are trying to answer everybody's questions. So please ask questions and we'll help you as fast as we can. And please subscribe to our channel if you haven't already. We don't want you to miss any of our videos. So to do that, hit the notification bell. That way you get a notification every time we put out a new video. Thanks so much for watching. I'll see you in the next video. Bye-bye.